If you're new to PACU and you need to have a framework, this really will train your mind to think about everything that you need to consider on these patients as they're coming out of the OR rapidly and you're doing quick recoveries. I mean, the PACU is almost like doing admissions and discharges all day long because they're coming in, you're getting a rapid assessment, you're figuring out what you need to do for them, you're recovering them, they're recovered, and then you're transferring them again. I want to talk to you about safe handoffs. I know it's something that we all strive to do, is to maintain safety, but there are definitely times where standardization falls to the wayside. You get super busy, slammed with multiple recoveries back to back to back. You're scrounging around looking for some piece of paper to write on. I mean, sometimes you can't even find a pen. And I know because I've been there, and I will share with you all a little secret that I have used for almost the whole 5 years that I've been in PACU, and it is my standard report sheet. It was created at the bedside, adapted at the bedside. I hope that you are really going to find it valuable. You can fit 4 patients onto this report sheet. So if you go through like 8 patients a day, you'll go through 2 pages, or if you go through 12 patients a day, you'll go through three pages. It's a way to keep your brain organized when you're getting rapid fire from the OR. It just minimizes the constant repetition where you are writing down the same thing over and over and over again. I've streamlined it so that you can just like circle if it was a general anesthesia, or if it was a TIVA, or if it was a MAC, or if it was a spinal, you can just, plug in spinal on the blocks. If they came out with an ET tube in, or if they came out with an oral airway in, a lot of us have to document when that oral airway comes out. When they arrived in the PACU, if you're not clicking it immediately, if you don't have your electronic medical record open, which you should have it open when your patient is coming from the OR, but sometimes you have those surprises that just get dropped off in your department. And that's when you can just grab your standardized report sheet and just quickly start running down all the drugs and all of the basic things that you need to get from anesthesia so that you can care for these patients safely. So the very first section is going to be going over just the demographics of the patient, their name, their allergies, their code, their precautions, age, weight, and kilos, the surgeon, what surgery they're having, what OR did they come out of. Because if you need to call that OR back again, you want to know the OR room so you can call directly into the circulator to have a communication with the surgeon if problems arise in the PACU. Then we move over to the right-hand side of the report sheet, which is the anesthesia side. So it's the anesthesiologist or the CRNA's name, their cell phone number, or their extension, the arrival time to PACU, the type of anesthetic if they have a block on board, and then airway management. And then I always throw in the ASA just so I know what kind of comorbidities I'm dealing with. And as you get fluent in PACU, you'll be more attuned to listening for that and report. So then I quickly go down the induction drugs because anesthesia is going to go over like how much Versed did they get, or fentanyl, or Dilaudid, or propofol. And it's really important to know, did your patient get a gram of propofol? I mean, that's going to have a huge negative inotropic effect on their cardiovascular system, and maybe their blood pressure's in the tank and it's because they got a gram of propofol. So these are just good things to know. And also you can pull a lot of this data from the anesthesia report on your electronic medical records. And I've done that before where, I get a 5-10 minute heads up knowing that OR 8 is coming out. And I just go in and I just plug in everything so that when they arrive, I already know the bulk of the history. And then I can just plug and play of like, okay, how much EBL did they have? How are the hemodynamics? Did they get blood products? Do they have a history of OSA? Did they bring their CPAP? Did they have a history of PONV? Did they get some antiemetics prophylactically? As I said, you can pull some things from the electronic medical record. If you don't have time to do that, you still have this framework to work from so that you can be organized in your thought, especially when you're on like your sixth patient of the day and you're tired and exhausted. It gives you a framework so that you don't have to say, oh my gosh, did I forget something? There's areas, I's and O's, so your fluids, blood products, output, drains. If they were maybe a TAVR or an ablation or a carotid angio, and they had vascular access, whether it be venous or arterial, I do have a little area down here for the hemostasis time so that you can just make a mental note of that so you can count down your bed rest hours. And then your IV access. And then in the middle is your incisions, your dressings and drains. And if they did get any kind of local, you just want to be able to note it there. And if they need any post-op imaging, maybe they need an x-ray post-op before they leave the PACU. So just a little mental note and get that going. And then PACU interventions, we always get their baseline vital signs when they arrive. And maybe your charge nurse is settling your patient for you because you're wrapping up your lunch break or your dinner break. So I can't tell you how valuable these standardized report sheets were. In one of the PACUs I worked at, we used these routinely, and it was so great when your charge nurse just did a plug and play. And then when she gave you handoff when you came back from dinner or lunch, you didn't have to try to read chicken scratch. Everything was pretty much spelled out here, and it really minimized a chance for an error. Sometimes you just want to not have to shuffle through a bunch of clicks to find out that information, and that's why we have standardized handoffs so that you can quickly assess what was been done, what needs to be done to get this patient moving through the phases of care. So, and then over on the left side of the page is just a head-to-toe assessment. Past medical history, past surgical history. If they, have any neuro deficits or cardiac deficits or respiratory or GI or GU, you can just note it in there for when you give report to phase 2 or for inpatient or ICU. And then there is an area for labs noting like a negative COVID, which obviously by the time they get to you, that should have all been addressed. But I'll tell you, when we were in early pre-COVID, we had some people who got through. It's good to always just have that checklist and remember that you are looking for these things. Basic electrolytes, a CBC, a BMP, and a glucose post-op. And then just things to note to do, like family, call the family or bring them back. Where are their belongings? Do they have, a hearing aid, glasses, dentures, their clothing, their valuables, and then who you're giving your handoff to. You want to write that nurse's name down, the room that they're going to be going to. And then if you had to do anything with prescriptions for the discharge or the transfer, and then their discharge time. I know that a lot of nurses who've been in PACU a long time, this is kind of just like autopilot. But if you're new to PACU and you need to have a framework, this really will train your mind to think about everything that you need to consider on these patients as they're coming out of the OR rapidly and you're doing quick recoveries. I mean, the PACU is almost like doing admissions and discharges all day long because they're coming in, you're getting a rapid assessment, you're figuring out what you need to do for them, you're recovering them, they're recovered, and then you're transferring them again. And as a PACU nurse, I mean, if you did, 8 patients, and that's an average day, 8 patients, I mean, you got report from anesthesia, then you're giving report to phase 2 or inpatient or ICU. So you are yourself at least doing 2 handoffs, which could equate to 16 handoffs. The ones receiving and then the ones that you are giving in the course of your day. And if you're pre-oping those patients, well then, just add 2 more on, their intake and then the OR handoff. That's 4 handoffs on 1 patient. So handoffs go on all the time. We really need to look at how we do it because I tell you, a blank piece of paper or a paper towel is not a standardized handoff. And I know we have Epic, but the Joint Commission says that we should not follow just an electronic medical record for standardized handoffs. The Joint Commission back in August 2012 actually released some guidelines targeting safe handoff communications, and they even developed a targeted solutions tool. I will have links in the show notes referring you back to the Joint Commission's guidelines, but I do just want to read to you one thing that they state in here, and it is hardwiring your systems. And this includes developing standardized forms, tools, and methods, such as checklists, identifying new and existing technologies to help make the handoff successful, and stating expectations on how to conduct a safe handoff. So, and we always should have the opportunity to be able to ask questions. That is the key point to the handoff, is that the receiver has the opportunity to ask questions. And with this safe handoff form, I have 3 references. One is the Joint Commission's reference saying that 80% of serious medical errors have occurred when there's been miscommunications between transfer of care. And then ASPAN has a standard of practice recommendation number 6. And if any of you, many of you PACUs should have ASPAN's standards within your department. Practice recommendation number 6 does state that the PACU nurse is responsible for that safe handoff between phases of care, and that opportunity for questioning should be provided between caregivers, and standardized tools and methods are utilized to communicate to receivers. Take this back, reevaluate what you're doing within your hospital, in your department, and see how you can improve on your standard of care and your safe handoffs. I hope that this helps with your standardization of a safe handoff. Yeah, throw those paper towels away, use them to clean up messes, not to make messes. So I am Nurse Kathy. Thank you for tuning into PACU Nursing Minutes. If you would like to get a free download of Safe Handoff form, then please find me at PACUNursingMinutes.com, where you will be able to find access to download this form. Thank you so much for tuning into PACU Nursing Minutes. I'm Nurse Kathy.